Here we've got
Hey, how are you?
Dr. Mike Waldrum here. How are you, sir? Dr. Waldrum, of course, is the Chief Executive Officer of ECU Health and also the Dean of the Brody School of Medicine.
Yeah.
He wears two hats. Which hat are you wearing this morning?
Well, really all of them. I mean, this whole activity, I've been on the board of this group for 10 years. I've been here 10 years and I started working with them right away. And, if you're going to improve the health and well-being of Eastern North Carolina, which is our mission, there are three major things that you do. You educate people so they make good choices and they have opportunity to get jobs. You, you, so you educate them, you create jobs, you give them economic hope and opportunity, and you provide excellent healthcare services. So whether we're educating the future workforce or we're uh, providing excellent healthcare, they're all integrated. And that's what we're doing here with this really unique set of activities. And I've been instrumental in forming it with this group because we need our people to be prepared to have great jobs, and that's what this is about. And our companies need great employees, and that's what this is about. And then we obviously, the largest employer in Eastern North Carolina, we need people that want to work with us and provide excellent health care. And so that's all integrated. And it's a unique, we're the only thing like this in the country. We've built something really unique. We're getting a lot of national attention. And that's what we're here to do. It's part of the ECU mission, regional transformation. And we're creating solutions for rural America and rural North Carolina, and that's what we're here to do.
Well, I'll tell you, when you talk about job opportunities and growth industries and things like that, I mean, healthcare is at the tip of the spear.
Yeah.
In Eastern North Carolina, and ECU Health is the reason why. I talk about it all the time. I mean, I've watched the metamorphosis of ECU Health, Vidant Health, Pitt Memorial Hospital, which is what it was when Leo Jenkins had this dream. But you look at that campus over there, and you look at what is in Greenville, and it's just it's unbelievable. I mean, it really is unbelievable what has happened in 30 years in Greenville.
Right. And it's because people coming together to do exactly what I said, come together to solve these problems and do the right thing for our communities. And that's what we're talking about, and that's what we're concentrating on. And you can hear the energy in this room already. I mean, it's really exciting.
Yeah. The NC East Alliance, I've watched this organization for many, many years. It hasn't always
No.
had the kind of focus and mission that they've got right now. But I mean, the leadership with Van Rogerson and the chairman, Todd Edwards, who is, I think, one of the all-time great Eastern North Carolina people.
Great guy. Both of them. I mean, yeah. So, we went through a hard time. Everybody, was in the paper and everything, but there were a few of us, about four, that we said, no, what are the real issues? And we literally put ourselves in a room for a number of, times over multiple hours. And we said the biggest issue is really workforce. And because we have people that want jobs, and we need to support our schools and support the pipeline. And I don't know all the technical terms, but it was really that. And because when I'm that, like you, involved in a lot of discussions around economic development, and the number one issue that every business has is workforce. But then we have people in our communities that need jobs. So this is about making that connection.
Yeah. Do you think the what really sent it into hyperspeed was getting the grant from the legislature? You got $15 million year before last, or was it last year?
It was in this last budget round. Well, obviously that gave that a lot of the groundwork would have been done. We were quietly doing work and showing that this program can actually create workers that are ready to enter these different fields, aerospace, healthcare, and the different sectors. So, a lot of work to demonstrate that. And then, so we were quietly working, but then, that definitely kick started it. But I think importantly, our philosophy is the regional perspective. And it just so happens that regional perspective is our market, the health assistance market, is our 30 counties that we serve, 1.4 million people. And so, we did a lot of groundwork, but clearly the support has helped a lot. And we're getting a lot of attention now because we have a proven product. And, so it's really exciting.
Yeah. I grew up in Eastern North Carolina. I've watched what's happened here through my lifetime. I've moved away and come back twice. I love living in Eastern North Carolina, but not everybody gets that.
Oh, that's a great place.
But and you're the same way. You've lived in big cities and you love living here. But I mean, I've worried for years that we didn't have a focus on what we were going to replace agriculture jobs and family farms and those kind of things. And there hasn't been much of, in my opinion, this just one man's opinion, there hasn't been much of a focused effort to work on that. And I think that's what you guys are doing right now. So I'm really excited about it.
Well, we're very excited. The energy is great. The momentum's great. Those of us that lived through the hard years, we're so excited to see this really taking off and what it's going to do for our region. I think you're exactly right. How it's such a beautiful area, and how do we, attract people here, but then retain people, that grew up here. It's a great place. Why do they have to leave to go get economic opportunity? And so, it's really an exciting thing, and it really has come about by a lot of people coming together and looking at the region and understanding that this is region, right?
Yeah.
We have people that drive to Pitt County from all over the East to work, right?
Mhm. Yeah.
And we need the other communities in Eastern North Carolina to do well.
You got the right people working on this stuff, and there's some really good people doing it now.
Yeah.
So I'm excited about it. Mike Waldrum, Dr. Waldrum, the Chief Executive Officer for ECU Health and Dean of the Brody School of Medicine. Thank you, sir.
Thank
Good to
you.
see
And
you.
thanks for all you do to help ECU Health. We have such great professionals, team members, doctors. We've had great recruiting. Things look great. We have a lot of work to do
Yeah.
to do that. But
Well, not everybody has my perspective. I've watched it and seen it, and I know what it was before it became what it is. And it's just something that we all should be proud of and very happy that we have the kind of healthcare that we have here. Best in the nation. Yeah. Good to see you, Mike.
good to see you. Thank you so much.